Okay, so we're here live with Jessica, and this is the Moccasin Telegraph. I'm just wondering, first off, who are you?
Who am I? Well, my name is Jessica. My last name is Swain, and I live in Calgary, Alberta. I grew up in Alberta, and I am a midwife, and I am Cree Métis, and I work in Calgary, serving women in the city, but also I serve other women as a midwife out on reserve. And my focus and my what I like to do is to help provide midwifery services to Indigenous women in particular. So that's kind of who I am and what I do.
What does
Just
what does a
yeah.
midwife do? For those that don't know.
Oh, yeah. So midwives, we're primary healthcare providers, which means that we are autonomous healthcare providers. So we work on our own and we take on our own client load of patients or pregnant women. So we provide full scope maternity care, meaning that from the time a baby is conceived until about 6 weeks postpartum, we provide full scope maternity care with the same scope as a family physician could. So we can order all the same labs, ultrasounds, all that sort of thing. We see women on the same prenatal schedule as a family doctor would. And when it comes time to have a baby, we are kind of best known for being able to offer a little bit more choice in terms of birthplace. I think that's what most people know us best for, is being able to offer out of hospital birth. That being said, I have admitting privileges to every hospital site in Calgary. So I also, you know, catch a lot of babies in the hospital. I had a client the other day say, "Oh, what does this mean, catching babies? Like, do you deliver babies?" And I say, yeah, we do, but we like to reserve that word for moms. We think that moms actually deliver their babies and they do all the work and we're just kind of there to catch them. So if you hear me use that word, catching babies, that's what that means. It's just different terminology to kind of put the credit where credit is due for who actually delivers babies. But we catch babies wherever women kind of want to give birth, as long as they're low risk and healthy enough to do that. And then we look after moms and babies for 6 weeks postpartum. So once a baby is born, then we kind of become the baby doctor and the mother's primary healthcare provider for 6 weeks postpartum. And we then discharge them after about 6 weeks back to their family doctors, and they kind of carry on with life until they're ready to have another baby.
So,
Yeah.
for those that are just watching, Jessica was actually my wife, my partner. She was our midwife for our baby, and it was a
Yeah.
pretty like it was a traumatic experience. And we're not going to get too much into that.
Mm-hmm.
I'll save that story for maybe another day. But I found it
Yeah.
really reassuring because with doctors, it's kind of like somebody that you see, and then you for a couple minutes, and then you leave. But it really felt like I had the best support in my corner at the time when all the insanity was happening. And it felt really good. I personally prefer midwives more than anything else. I'm just, for people that are watching, the context of this is that she was actually a midwife, and I cannot say enough good things about midwives.
No,
Saying
thank
that,
you.
and you've kind of laid out the scope of what midwife looks like. Um, oh, sorry. Before I jump into the next question, what is the Four Directions midwifery?
So Four Directions Midwifery is like a long-term dream come true for me. So it is a midwifery practice that has been established in particular to help provide midwifery care to Indigenous women. So so we are a collection of four, soon to be hopefully five midwives who all identify as Indigenous, and we have come together, and our mandate and our goal is to help expand access to midwifery care to women who maybe otherwise wouldn't have access to it based on, geographical or transportation or even communication barriers, because we just really love our women, and we want to be able to not only provide them with midwifery care, but also to kind of inspire women from their own communities to maybe reclaim this role of being a midwife, because it's something that was definitely lost through colonization, which is sad, but I think there's remnants of it there. And, we all hear stories all the time from our clients saying, my grandma, or my auntie, my great auntie was a midwife, and she caught all the babies in our community a long time ago. And so, I mean, beyond just being there to provide this service, what my hope is that by providing this care, that a woman from one of these communities might say, hey, like, why can't I do this job? And then maybe even put me out of a job and, on one of these reserves, like in 5 to 10 years, that would be kind of a dream come true. So we're there not only to provide care, but to also help and inspire women, hopefully to like reclaim that role, because it's sacred and it needs to come back.
So your dream is to help mentor and guide nations to become autonomous when it comes to having their own births, so they don't ever have to leave if they don't want to. They could just do it all in-house.
Yeah, I mean, and that would be amazing. Like that would be so amazing. We have, our rate of women actually having babies on their land is still quite low. But that being said, we do try to provide, cultural and like that continuity even when they have to come into the city. And it kind of speaks to what your experience was, Gitz, is that, when you have the same person with you from the very beginning through to the end, even if things do go unplanned or things don't happen the way you expect them to have that person who just like knows you so intimately, knows your experience and your story, can help you not only just like move past what happened, but I think almost experience some kind of like, growth after what may have been a traumatic experience. That being said, most of our moms do have like, healthy, low risk, really beautiful, straightforward birthing experiences. But yeah, I mean, we're hoping that by being able to just kind of provide that care in the context that we're able to now, that eventually, for sure, like I would love nothing more than to be able to go out, to the Stoney Nation and be able to look after moms in their communities and have them even be able to write on their registrations of birth that their babies were born on their land. Like that is just so, that would be a dream come true. That's what we hope for. Well, what I hope for personally.
Technical thing. I need you to slide to your right a little bit. Perfect.
There?
Okay. And try not to move too much. Okay, so you've laid it out for us. You've laid out what your dream is for this.
Mm-hmm.
How has the COVID-19 crisis changed the midwife practice?
Well, we do really hold dear that tenet of care of ours, which is to provide continuity of care, meaning that, your care provider.
Whoa, something happened. Are you still there?
That their care is kind of revolved.
We had. Can
you hear me?
Yeah, there was a little bit of a block right as soon as it started. So can we retry that question again? How has COVID-19 changed the midwife practice?
So what I was saying was just that, like, there's two tenets of midwifery care that are really important to us, among others, but one of them is continuity of care, and one of them is woman-centered care. And so continuity of care just means that it's really important to us that when a woman goes into her birth experience or goes into her birthplace, that she has a familiar face there and somebody that she really recognizes. And we also do women-centered care, meaning that we really want our care to revolve around each individual client's needs. And COVID-19 has made that more difficult just because, our regular prenatal schedule has been, kind of diluted a little bit just because we're trying to just reduce contact. And I think all care providers are kind of doing the same thing. So, whereas, we would have women coming in every 4 weeks in early pregnancy, every 2 weeks, and then weekly after that, we're kind of having to scale that back a little bit and do more telephone type interviews to make sure women are okay, and just kind of sneaking them in to do blood pressures, belly measurements, and that sort of thing. And then sneaking them back out the door again. So what I feel like this is affecting is that ability for me to just like really sit down and like lean in with my clients and spend that extra time with them, not only to like look after them on that physical level, but also to kind of delve into, what they're experiencing on more of like a mental, emotional, and spiritual level. So that's what I'm really missing from all of this. Obviously, even the physical contact, I'm a bit of a hugger. So, I really love to give my clients a hug now and then, and I can't really do that. So that's definitely a bit weird for sure. And I had 3 babies born last week, 2 in hospital and 1 out of hospital. And I have to say that the births all felt beautiful. Like I didn't feel a huge difference in that regard. But so that's good. But I think that might change in the coming weeks as things get a little bit more serious. We've also had a lot of moms who were originally planning hospital births saying, what about this out of hospital birth thing? Like, what does that look like? And so that's been an added thing for us to kind of deal with too, is helping make sure that moms are making the decisions about where to have their babies, not out of fear, but because it's what they wear and how they really want to have their babies. Another thing that's been a huge thing has been like they've really restricted the amount of people that are allowed in the hospital. So when we go into the hospital, there's a very strict one support person policy, which especially for like our Indigenous moms, like one of the things that we love is being able to kind of sneakily bypass the like existing visitor policies and have a few more people in the room, just to kind of give it that feel of like being really well supported by your community and your ancestors and your family. So the restriction of one support person has been really hard for a lot of moms because some of them have doulas, some of them have aunties or other people that they want to have in their birth space, and they just can't really do that right now. So that's been really, really tricky and really hard.
What you said? There's only like one person allowed in with the person having giving birth. What other restrictions are you seeing in the hospitals right now?
Um, well, restrictions on like who can come in and who can go. That's kind of the biggest one right now. I haven't had anybody in my care. We haven't had anybody in our care yet who's symptomatic of COVID-19. If they were, then the restrictions would be pretty extreme for somebody like that. But otherwise, it's little things like dads or a doula can't go out to the fridge and get their partner or their client a glass of water, right? Like all that stuff's kind of on lockdown. There's a lot of supplies and stuff that are like rightfully so being kind of held outside the room to prevent like contamination and touching and all that kind of stuff. And when we do bring our clients into the hospital, they're really well screened when they come in. So they're getting temperature checks and they're being screened for symptoms to make sure that everybody who is coming into the labor and delivery ward is symptom free.
Yeah. What are your biggest concerns as you're doing home visits and doing checkups?
Oh gosh. My biggest concern when doing home visits is that I can't self-isolate right now. So in my line of work and like a lot of other frontline workers, we can't stay home and self-isolate. So I'm in contact with a lot of people all the time. And my main concern is just, the idea that I might be the one, right, who ends up being that point of contact for this to somebody else. I mean, that's my biggest concern. I mean, I think as healthcare workers, we're all, putting on brave faces and we're not thinking so much of ourselves and us getting infected and getting sick as so much as like, are we doing enough to make sure that, when we do go do a home visit, that we're taking all the precautions we possibly can to prevent us from being the vector in that regard. So that's tricky. On the other hand, the alternative is people coming into clinic for their postpartum visits, which as midwives, this is something maybe we didn't talk about, but we do a lot of home visits. So, when somebody has their baby, we also are kind of that community health nurse role. So we go into people's homes when they have a new baby and we do the checkups and the breastfeeding support and all that kind of stuff. And we even do like a lot of prenatal home visiting. So for my moms and my clients who are experiencing maybe like geographical barriers to being able to come into the city for care or transportation barriers or even communication barriers, I mean, we do a larger number of prenatal home visits where we're going into women's homes and doing their prenatal care in their home to prevent them from needing to come into the city. So, I mean, I think it's good in some ways because it means that it's saving that mom or that family needing to come into the city and be exposed and then bringing it back to their community. But I mean, every time I go into a house, I'm just like, I just, worry that, that's going to be that's going to be what happens is it's going to be me bringing it in. That being said, I think that with my education and with what I know about this, like obviously I'm taking all the precautions and we all are, but that's, I think, what weighs heavily on all of our hearts right now is just not wanting to be that person,
Yeah, so you don't want to be the, it's not, just to recap, it's not you getting sick. It's you being sick, not knowing, and then bringing it into these places. That your bigger fear is just, it's not yourself. It's really everybody you're working with.
And they're elders. Like that's my main concern too. We know that most women who like, there hasn't been a lot of research done on this. I mean, there's been a few cases like in Wuhan of women who were pregnant and did contract COVID-19 and their outcomes were really quite good. We know that there's like a low risk of like vertical transmission. Vertical transmission is when a disease is transmitted from mom to baby. We know that that's a very low risk we don't know. We know from limited evidence that it's low risk. And my main concern is also just the elders, right? So when I go into a home and there's, mom and dad and plus their parents and maybe their grandparents in the home, I worry about that, right? And just not wanting for our elders to become overburdened and sick
So
with this.
if somebody's pregnant, like right now, what should they be concerned about regarding COVID-19? Like, so someone just like, oh shit, I'm like 3-4 weeks late. What should I be? This is a different world. What should I be worried about? What should I be concerned about?
I would say like that social isolation is so important, just because we don't really know how, how COVID, like, I mean, coronavirus is the virus and COVID-19 is the sickness caused by the virus, but we don't really know. We don't have a lot of data or information about how this could affect somebody in early pregnancy, especially. I mean, we have limited evidence based on other kinds of infections like SARS and H1N1, which make us feel somewhat confident that it's not anything to be overly concerned about. I mean, in terms of like it being worse for pregnant women to be infected with this than the general population. But I would say if you know that you're in early pregnancy, for sure, like those self-isolation measures are extremely important, just to make sure that you're staying as healthy as possible and preventing infection for yourself.
So it's better to just side on the air of caution rather than reading some kind of like Facebook social media post about don't worry. You're saying worry, not really worry, but just be careful. That's what, correct?
Yeah, I would say just be careful and just, like those little things where it's like, okay, I could run out to the store to get that. For me, it's the bag of chips, right? Like I'm like, oh, I'm out of chips. Like not doing those extra things that might put you at increased risk, right? So really following the recommendations, and eventually this is gonna this is gonna peter out and it's gonna be different. But I would say for now, definitely just following the recommendations, because we don't know what we don't know, and I think it's always better safe than sorry. That being said, I'm not saying this to like try to scare anybody either, because I think that risk of like added stress is also really real. But I mean, yeah, just making sure that you're keeping yourself well and keeping your immune system healthy too. So, taking your vitamin C, taking your vitamin D, and trying to like almost like reduce stress, because stress makes us more prone to our immune systems kind of being crappier than they already are in pregnancy. And that's another thing, is that in pregnancy, for very good reason, often our immune system is a bit less, like our immune system kind of tapers back a little bit. We're growing something new in our bodies. And if our immune systems worked too well, then that could put our babies at risk. So in pregnancy, our immune systems are already kind of extra crappy. So, just anticipating that you might be more at risk with a bit of a depressed immune system in pregnancy to actually get sick than somebody else.
Okay. So we talked about early pregnancy. What about late pregnancy? So if someone's in their third trimester, they're about to labor, what should they be concerned about?
Well, the good news is that from the limited research that we have in terms of how this infection affects late pregnancy, I think, and don't quote me on this, this is just from like reading on the World Health Organization and the SOGC, which is the Society of Obstetricians and Gynecologists webpage here in Canada, that the number one thing that they've kind of seen is possibly going into labor a little bit early. So having these, we call them late preterm babies. So those are babies born just a little bit before 37 weeks. But I would say the number one thing to watch out for in late pregnancy would be, again, just making sure that you're keeping yourself healthy and well, staying well rested, staying well hydrated, doing that social isolation is also really important. So as pregnant women, we're healthy. Like pregnancy is not a state of sickness or disease. It's a very natural and normal life process. That being said, pregnant women are the healthiest cohort of people accessing healthcare the most often, right? So in pregnancy, you're seeing a healthcare provider more often than pretty much any other time in your life as a healthy person. And so, you also then become almost like a risk to those who are trying to provide care. So if I have to see 10 pregnant ladies in a day and one pregnant lady is not really taking this social isolation thing seriously, then, the likelihood of her coming into contact with me, and is greater of spreading this to other people. Does that make sense? So that in that way, I just think that if you're pregnant and you know that you're going to be needing to be accessing healthcare, that, you should be extra vigilant, not only to protect yourself, but also to keep in mind that that healthcare provider just is going to be in contact with a lot of other healthcare providers and other pregnant people who we want to keep safe.
So along with social isolation, what are some best practices that parents, so people that are pregnant and their partners can do to help provide this area of protection for their babies?
So I would say that, as a midwife, one of the things that I recommend routinely anyways is, that first week after you have a baby, really kind of guarding that, and trying to prevent too much exposure of your baby to a whole bunch of people. The beautiful thing about pregnancy and breastfeeding is that when you are exposed as a pregnant person to any kind of bug, that bug kind of gets processed through your immune system, and then you produce antibodies, and you develop an immunity to those bugs, and then that immunity is passed through your breast milk in a lot of ways. So breast milk has this amazing immune quality to it, and so that being said, a mom who's living in her little bubble is going to have been exposed to all the different bugs and bacteria, good and bad, in her environment, and she's going to almost be able to provide immunity to her baby in that way. But when you start bringing in other people from other places where there might be other bugs and germs and things like that, then it's not that your baby is not still well protected through breast milk, but if you haven't developed an immunity to that yourself as a parent, then it's harder for you to pass that on to your baby. So it's hard because the birth of a new baby is it should be such a celebration, and it's hard to kind of keep people at bay. That being said, if you have just had a baby, you've also probably been in contact with healthcare providers and you've been in the hospital, and so we know that this disease does kind of stay asymptomatic for quite some time, which is why it's just such a difficult thing to get on top of. And so if you're coming out of a hospital, you don't know if maybe you have been exposed, and it might take a couple weeks for those symptoms to show up. So flooding that new parent with a bunch of visitors could also be a way that this could be spread.
Oh, wow. So a parent leaving the hospital could be exposed to it, and then when they go home and people want to come see the baby, want to come see them, the parent could essentially be the catalyst.
Yeah. And and that's just with anybody accessing like the hospital too, right? So, when you're at the hospital, the auxiliary workers in the hospital who are working day and night to keep those areas clean and sanitized are amazing. They're the real heroes of all this in a lot of ways. But you just don't know that you touched a button on the elevator on the way in or something like that. And I'm not trying to be alarmist, because I think that there's like a risk of that too. But, I think that we live in a time where we have this amazing technology. Like you and I are sitting here in self-isolation, having a discussion, and, we do have those technologies to be able to bring people closer together without bringing them physically closer together. So I would, recommend maybe doing more FaceTiming and doing more stuff like that, and just letting new parents focus on rest. Dropping off things at the door, that's really helpful. So if you're close to somebody who's just had a baby, bringing food, just dropping it off at the door, that is so helpful, even not in these times, right? So doing things like that kind of support people from a distance are still beautiful, loving things to do.
So you're figuring that's kind of the best way for extended family to support new parents is drop off some food, do some FaceTime, some calling, but having love from a distance.
Yeah. Oh. Yeah, I think so. And it pains me to say that, because as midwives, we want so badly to celebrate new babies and new moms and all that stuff. But I think that we really should be utilizing some of the tools that we have at our disposal just until things settle down a little bit.
So along with that, how are you doing?
I'm doing well.
There's a lot you're saying right now, and that is a lot to carry. And so I'm just wondering, how are you doing for real?
I have my good days and my bad days. I was off call for a bit, and the thought of coming back on call was really scary. Like, I mean, we're getting bombarded with a million emails a day with updates and things that are constantly changing in terms of how, as healthcare providers, we can do our jobs. And so I'm also like a single mom of a little girl, and my work is I love my work and I would hate not to work, but it's scary. It's scary to think of what could happen if I did get sick, like who's going to look after my daughter, and where's the money going to come from, and all that kind of stuff. So many things that other families are also really struggling with right now. And then I also have in my life, I've been in like all these car accidents and have realized that I have kind of an intimate relationship with a little bit of post-traumatic stress and what that feels like. And I find that in this time, those places in my body where I kind of hold tension and stress and anxiety are definitely talking to me more often. So if I were to do a body scan on a daily basis, I would probably find more areas in my body that are kind of asking me for attention and kind of trying to alert me, right? So it's a really weird place to be because, if you've ever been to like the coast and, you see those signs and there's like that little guy running away from the tsunami and it's like, this is the tsunami escape route. It feels like we're all kind of just standing on the beach going like, okay, like, when's this going to hit? And, how's it going to go? And it's hard because the hardest thing about like trauma, if you have a history of that, is it's not so much like the event itself. It's kind of that moment before when something's going to happen and you can't do anything to control it or stop it. That's kind of where trauma happens, and I think that, sometimes that looks a whole bunch of different ways, but right now it looks like all of us kind of just sitting here going, okay, we know that maybe this really bad thing is going to happen and there's nothing we can do to control it. And so for me, that's hard because so much of what I do in my work is keeping people safe and trying to hold space for people to be in those places themselves just in birth. But now it seems like there's that added level where I'm also trying to keep people safe from that like mental and emotional and spiritual fatigue from constantly being in that like fight or flight response. Yeah. Does that make sense?
I often use that the analogy of the tidal wave hitting, because like in a state like this, there's the people who take off right away because they know the land, they know the area, and they're not really concerned with the cause. They're just like, something's gonna hit, we need to get higher. And then you have people who are on the beach who were like, you worry too much, relax, just be cool. Then you have people who are like, oh, look at all those little cool fish down there, let's go check it out. And they go down further into the epicenter. And you got people who just don't give a shit, and you kind of have to interweave between your family and your friends through all of this, and at the same time try to remain as calm and rational as you possibly can, even though this wave is like hitting, as we're talking right now, this wave is hitting Canada. We look to other countries, the States, and we see how terrible it's become, and we really pray that it doesn't happen like that. But that really woke that analogy of the and people can look it up right now. Like if you're gonna YouTube, just YouTube like tidal waves when they hit certain beaches, and you'll see people fucking off, people staying, and people going down further.
Yeah, and that's like human nature, right? Like I think we all have different ways that we deal with things, and I think they're all ways to maintain a sense of control, right? Like the people who are sitting on the beach are saying, you know what, I'm going to maintain a sense of control over this by not letting it affect me, by not letting it really change my day-to-day, because that's how I can maintain control, right? Then there's the people who are running to higher ground, and they're trying to maintain a sense of control by trying to get away from the bad thing that's coming. And then there's the people, like you said, who are, going snorkeling, and they're the ones that are, trying to maintain a sense of control by saying, you know what, like, I'm going to be defiant of this thing that is trying to scare me. And so I think it's human nature to have all these different responses. And I have to say that, when I am out and about, people are taking this really seriously. People really seem to care. And there's a select few, obviously, who, are taking it a little bit less seriously. But, what can you do? But yeah. And we won't know. The hard thing about it is that if we all do this really well, then, we might not see a huge effect, but I think we will. But it's one of those things where it's like, oh, okay, well, that wasn't so bad. Like, why did we make such a big stink about it? and that's a really hard place to be, to put yourself in that like collective versus individual mindset of, okay, we're doing this for the collective right now. It sucks individually to be stuck in your house, but it might save somebody's life,
I was just
right?
talking to Ramona yesterday. She's from Italy, and we were talking about when they had their spike in deaths and how that was. And she's like, you go to sleep. The army would pull up once a week to their towns or villages to retrieve bodies, because that's how much people were dying. And not necessarily like COVID, could be like a heart attack, could have been whatever. They couldn't get to the bodies. And I'd ask her, like,
Yeah.
what were you thinking? And she's like, at nights, I would wonder if I was going to wake up, if my husband was going to wake up, if my son was going to wake up. And I just think about that, how scary that is. And we're not there. And I hope we don't get there. But we don't know right now. And that's like the craziest thing to me.
Well, and when we talk about being able to like use, like we're in a really special time where we can use technology to outsmart this, right? So being able to have those examples and have people in Italy right now that you can just pick up the line with and talk to, and they can tell you about what their day-to-day is, and they can say, here's the mistakes that we've made, like do better because it's coming. That is something that we're so, so lucky to have. Like in the history of human existence, there have been plagues, right, that have come and knocked out a ton of people, and it's not something unheard of. But if we're smart about it, we can use technology and we can use other ways to connect with people to kind of outsmart this bug, because it's a smart one. And the reason why it's so smart is because it incubates and it hides for a little bit of time. It's not something that makes you instantly sick. That's like a not smart virus, but this one's really smart. And so we have to outsmart it by knowing it's coming and doing all these things to kind of prevent it from hitting us too hard. So yeah, it's an amazing and scary time.
Where are you on this part of the spectrum? Because I ask this to most people that I'm doing these interviews for. So in terms of isolation, okay,
Mm-hmm.
there's a 1 out of 5. So where are you right now? 1, not at all, living your normal life. 2, being more cautious, avoiding large gatherings, travel, but still going out to eat, going to work, going to events. 3, going out as needed, getting groceries, etc. Mostly working from home, but still seeing friends and family. 4, only going out when unavoidable, very limited, careful contact with other people. Or 5, full-blown lockdown, no one in or out.
I would say I'm at a 4 because anytime I go out, it's for necessity to work, to go see like a client or a patient in a healthcare setting. So I would say I'm at a 4. I can't be in full lockdown. Yeah. So yeah, I'd say I'm at a 4.
So what is, like, as you're in lockdown in your house, what are
Mm-hmm.
some things you do to help keep sane?
Oh, well, luckily my daughter is 2, so she is unaffected and unfazed by what's going on. So I've been just kind of enjoying, like my work takes me away from her a lot. And, even when I'm off, we're often out busy doing things because I'm trying to go and get my banking and get the shopping and all that kind of stuff done. And I think staying sane has been just like looking at her and seeing how happy she still is. Like she doesn't really know what she's missing out on. And it makes it easier for me to kind of forget that too. I think if I had older kids who were like dying and just so bored and I wasn't enough to entertain them, that would be really hard. So I see it as like a gift of being able to kind of like just really spend those moments with her where I don't feel pressure to be productive or doing other things. And I hope that other parents can give themselves the permission to kind of slow down and just enjoy their time with their kids. When this first happened, I was having a hard time because I was like in my sweatpants all day. We weren't going out and doing anything. I felt like I wasn't being like productive. And I was like, oh man, I'm being such a bum. And now I just kind of embrace it. I showered for all the viewers today, so you're welcome. But yeah, like I put on something kind of nice. So that this is nice, but it's just been like, okay, like my family, my daughter, she just needs me and she needs me to show up and be present. And that's kind of how I've been getting through it. And then, Netflix.
Is there any special shows that you could recommend to people that are watching right now? Something that's caught your eye, something you're going through?
Well, I love RuPaul and I love Drag Race. So I'm watching like the new season on Amazon Prime and just like as the episodes come out. So that's kind of what I've been going through. I think like everybody else, I got sucked into, the Tiger
I haven't seen it yet.
King. Oh my God.
Is it crazy?
It's insane. It's just bizarre. Like, it's just so bizarre. Yeah, it's hard to believe that this is the world we live in, but that,
Someone said this
yeah,
is like proof that white people are crazy.
Tiger
Tiger
King.
King.
Yes, it is. It's insane. Like, I just, it blows me away that this is like people, some people's everyday existence is that kind of thing. It's just bizarro. So
All
yeah,
right, Dan, we're watching it tonight.
you are.
Yes, we're gonna definitely watch it because
Oh,
so many people, like, it's on social media. It's like out there.
yeah.
What is
Yeah.
the biggest lesson you'll be taking from this
Um,
when this is all said and done? Like, what when you look back, what is something like one of the biggest things you're gonna learn from this?
just that there's a lot of things that we really worry about that aren't as important as we think they are. Just kind of that reminder that um, at the end of the day, Mother Nature, like the Great Mother, kind of is more powerful than us, and that you just have to kind of like live your life day to day, and not worry so much about, I don't know, the little things that just when something like this happens make you realize don't really matter as much. Also, the family thing, right? Like, I'm an introvert naturally, so this has been a little bit easier on me, I think, than other people. But it makes you miss being able to just go see your family and go visit them and really like enjoy that time with them, connecting in ways that are just simple um, and meaningful. And yeah, yeah, that's kind of going to be it for me. And also just I think that constant practice of like tuning into my body, and learning to be kind of a master at realizing like what sensations in my body are like mine and which ones come from a different place, like whether it's intergenerational or whatever, and how to kind of tune into those places and kind of clear
Mm-hmm.
them and move forward, right? Because I think that that's the hardest part of all of this, is that constant practice of tuning in, clearing the anxiety, looking around, realizing there's no imminent threat, and then carrying
Yeah.
on. And that's, I think I think this, yeah, I think that trauma is the greatest teacher of our time. And I think a lot of us are facing some trauma because of this, or it's bringing up past traumas. And I really hope that everybody out there has a way to process that, because I think that that's really important. And that's how we're going to move through this in a way where we're not coming through it in a worse off place, but in a place of feeling like resilient.
So,
Yeah.
is there anything you want to add? Anything you're like, I should talk to this, or things you want to touch on before we conclude this interview?
Um, yeah, I guess just what I would say is, call your elders, speak to them, um, just honor them and let them know that you care and that they're important. And yeah, and just really look forward to that day where you
Oh, you cut out a bit.
my my
You,
advice, because
you cut
life
out a
is
little
really
bit.
fragile. Yeah.
You cut out just a little bit at the towards
Oh,
the end.
just I would say honor your elders. Realize that life is short. That we never know what's going to happen, and so just to enjoy the moments, to call the people in your life who are meaningful to you, who might have teachings and stories and things that are kind of in the vault that maybe they would love to share. I think it's a nice opportunity for that. So,
All right. So, last question. When
mhm,
this is all over and this is all said and done,
yeah.
what is one thing you're going to be looking forward to doing?
Oh, um, I think just, oh man, lots of stuff. But I would say just being able to go and enjoy being with people, right? Like, yeah, getting to be able to go to a birth where there's, family in the room, and getting to see how beautiful and powerful that is for birth to be a family centered event. Like, I miss that a little bit. Yeah, so that'll be really nice. And then personally, I think just being able to um, like take my daughter to see her cousins, and yeah, and getting that FaceTime with people that I miss and love.
Well, when this is all said and done, we're having a barbecue, and you and your daughter totally have
Yeah,
to come over.
I know, I know. I'm usually such an introvert that I'm like, oh God, like this is making me realize that I actually like there is a part of me that like loves to see people and I've been missing that. So I'm hoping that once this is all done, I'm going to prioritize that a little bit because I can go a long time,
Yeah,
kind of in my own little world. So yeah, that would be awesome. I would love that.
definitely coming over.
Yeah.
All right, well that's it. Thank you so much for doing this. We'll check in with you maybe in a week in a bit to see how
Okay.
things are going.
Okay.
But yeah, this is the big message for everybody watching. We are isolated, but we're still connected.
Exactly. Yeah. Yeah.
All right, well, ciao for now.
Okay. Bye. Do
Okay,
I
so
hang up Skype?
you could if you